this week's health news, and she's here now to take us behind the headlines. Lovely to see
that
you.
wasn't one of the health headlines,
No, it
but
wasn't, but
I'm
I
thrilled
loved
that
it,
we've
though.
established that engines are an important part of a man's body. Let's talk about online pharmacies. We talk every week about weight loss jabs. It's a hugely provocative subject at the moment. Interestingly, the stricter rules for these online pharmacies, because people have been able to get hold of the jabs without necessarily needing them.
Yeah, and I think that this is a long time coming, but it's very needed at the same time. So what they're trying to do is get stricter rules on people going online. A lot of our patients, a lot of my patients in my practice, in my NHS surgery, are struggling to go and get them because of supply issues, but also because not everybody meets the criteria. And so some people are going online and filling out a questionnaire or just sending some photos, or actually probably just fudging their medical history. So if there's a background history of eating disorders, not disclosing that to their private healthcare provider who's going to give them the weight loss injections and then getting them, and that will actually perpetuate further complications, because we're seeing a rise in people getting side effects such as profuse diarrhea, vomiting, nausea that can happen, constipation. So they are not an easy solution. They do have some side effects. So the idea is we get better regulation for those individuals, not just filling out a questionnaire, not sharing that information with their NHS doctor, not revealing that they might be on other medications, because we know Ozempic is for type 2 diabetes, or something that we use for diabetics. Wegovy and Mounjaro is licensed for weight loss, but actually we need them also in the NHS supply system for those that are diabetics as well.
Right. Yeah.
So you're not going to be able to fake it going online. It's going to be a much more rigorous process in order to prove you need it.
You should never try and fake anything about your medical history, because your health is at risk. It's detrimental to your health. But yes, we're trying to put those tighter rules for those that have an eating disorder or background history of eating disorder, or might have other complications that they don't declare, or actually be a healthy weight but fudge the numbers or lie about their weight just to get it. And so this actually is safety for patients, but safety for the prescriber as well. Also, we're trying to make sure that we have supply that meets the demand, the appropriate demand, because your BMI has to be over 35 or lower at 30, but you've got a type 2 diabetes or a heart condition. But also we're seeing counterfeit medication, which we've covered here on This Morning before as well. So the idea is trying to reduce and keep patient safety as the gold standard.
Yeah, great. Let's talk about a capsule that could be a miracle for those people who are really frightened of needles.
And discovered by looking at squids and the way they project ink out from their tentacles. And I just think that is so clever, how we look at nature around us and think this is what we could do. Now, we do know that people can have needle phobia. 1 in 10 people in this country do suffer from that. It's called trypanophobia, which is a fear of absolutely having needle injections. And that means that puts off individuals who need it for their health. So we're talking about individuals who need blood sugar monitoring because they're diabetic, or maybe need insulin through that. Also vaccinations, a lot of them are delivered. Kids, delivered through that method. So if this technology works, then it could be a game changer. It's the size of a small blueberry. You eat it, and what it does is it just sort of explodes, a bit like that tentacles from the squid, projects that medicines into the gut lining, so the absorption is quicker. Wow. Now, the reason we like injections is because that absorption happens very, very quickly, and we want things like that to get into the bloodstream quickly. Other medication, traditionally like tablets or capsules, they have to be dissolved, get through the capsaicin, then actually you get the hit of the medication. But this isn't new. We've had this before. So if you remember back in October last year, there's a trial out at the moment to look at plasters which have microneedles in them.
Yes.
So we can give sort of in the future to children a little plaster that comes through the door to parents. They put the plaster on and that gives their MMR vaccine or, you know, whatever, flu vaccine,
and will they feel it then?
They don't feel it. They're painless plasters. So I think in the future, I'm so excited as a clinician because this means that it's easy ability to give people their sort of medicine quickly and also save lives.
Brilliant.
And also the idea of it, like you say, taking it from what squid does in nature and stuff.
Absolutely, absolutely. And also we are seeing that individuals, if we can get away from needles, because needles have their own risk, not just pain, but if you think about risk of infection, then that's better. So this technology is very exciting.
Look how she's so excited about it.
Right, let's talk about the third headline. £20 DIY heart checker that can prevent deaths and save GPs time. Takes only 10 minutes.
We've got one here. We've got one here. So licensed for those so at 18 years and above, but free on the NHS if you're 40 to 70. So we can get a kit like this and you don't have an underlying sort of heart condition or you're not on medications like statins. So this is great. This makes me really excited because I'm all for patient empowerment and getting knowledge about your health. And this is a kit that comes through the post and it's a finger prick test that you do and it can check your cholesterol level for you. You can do your height and weight and there's an app that you need to download with this. And what it will do is to work out your BMI and then work out your risk for, say, cardiovascular disease. We use this in general practice already, something known as Q risk. So it gives us your heart age, it gives us your predicted sort of risk of getting a clot or a heart attack in 10 years' time. And now we're giving that ability to patients at their fingertips at home, which is great.
Wow. So the idea is that you link to an app as well?
Yeah. And then that app, with the data stored in it, can go into the NHS app. And so that will save us time as doctors at the GP practice. And that means that actually we can risk stratify all our patients because we can then pick up people who have, say, high cholesterol, if they're young in their 40s, might not have any other symptoms, and then say to them, oh, actually, you need to come in and see us and have, like, targeted specific groups that we actually then capture before they get worse.
And it will be available in the future for other things, not just heart and things?
Yeah, I mean, we already have technology already. So if you look at the glucose meters, so we've got those to check sugars already.
Do they go straight into the NHS, your files? Because the linking of that is pretty special. No,
it depends which one we've got. If you're a known diabetic patient, then we can. But we do have lots of other companies that give you sugar readings for privately, but that they don't go into the NHS. Right. But this one is going into the NHS, which is why it's really brilliant and exciting.
Right.
But it is for 40 years old and above, so just so you know.
Great.
Yeah, we were talking about saving time. You got the AI could be really beneficial in terms of breast cancer screening. Yeah,
I'm very excited about this. So this is a new trial which is looking at saving time and radiology. So when you go in for a mammogram, we're inviting women at the age of 50. When we do a screening mammogram, we need 2 radiologists to look at breast cancer. Because breast cancer is not easy because sometimes it can appear white, but also the mammogram can also, if you've got lots of fat in your breast, can also appear white. And so white on white, you just cannot see if there's a lesion there. And so what you need is real experts, and that means that 2 experts sometimes are needed. And then what this does is that the AI technology will actually do the work for you, freeing up radiologists to do the more complex cases, so maybe doing biopsies. But it means that we can get women through quicker through the mammogram procedure, because at the moment, because of COVID and the backlog of everything in the NHS, we've got roughly what's estimated about 1 million women still waiting to go through that sort of backlog that we need to do.
And it's so
time-consuming. And if AI can help us, then I'm all for it. So this is really exciting.
Final one, omega-3.
Yeah.
Do they help you stay young? That's what The Guardian says.
I know The Guardian says that in animal studies. I'm just going to put that out there. It's in animal studies at the moment, but omega-3 is so important for your brain, your heart health, and also your cognitive function and your energy levels as well. All ages, omega-3 is great. We get it in our breast milk as infants, and then if you can get it from oily fish, your avocados, you can get it from greeny leaf, nuts, berries, everything. So, yeah, great.
Okay, keep it coming.
But, yeah, whether it will make me 40 years younger, no.
You don't need to. You look sensational. Dr. Nighat, thank you. Oh, hello. Thank you for visiting our This Morning YouTube channel. We upload tons of new content every single day. So hit the subscribe button, like all the videos, and don't miss out. We'll see you in the morning.